Welcome to All Access, where we meet at the intersection of healthcare and generic and biosimilar medications. Brought to you by the Association for Accessible Medicines, representing the generics and biosimilars industry. Welcome to All Access. Turning tragedies into triumphs is one of life's great challenges. And in the early 20th century, Dr. Powers Flagg was a young anesthesiologist at St. Vincent's Hospital in New York City. He came face to face with a challenge that would later turn into a great triumph, which we're going to hear about today. But at that time, just a few months after losing his infant daughter to neonatal asphyxia, Dr. Flagg also had to bear the death of his wife. In his grief, he found solace in ministering to others, particularly those lacking in adequate health care. So it was after a trip to Haiti where Dr. Flagg witnessed the immense needs of patients on the ground in Haiti suffering from leprosy. Dr. Flagg founded the organization that we honor today and are very proud to have as members of the Association for Accessible Medicines. And now in their 110th year, the Catholic Medical Mission Board, commonly known as CMMB, is carry on that critical work that was begun by Dr. Flagg over a century ago, with a distinct focus on women and children's health all around the world. CMMB and its global network of volunteers deliver long-term care and medicines to communities in Africa, Latin America, the Caribbean, and other regions affected by poverty and who have unequal access to healthcare. The dedicated team at CMMB is helping countless thousands of people around the world turn their personal tragedies into triumphs. And I'm very honored and pleased to have with me today as our guest on All Access, CMMB President and Chief Executive Officer, Mary Beth Powers. So Mary Beth, welcome.
Thank you so much for having me, Dan.
It's great to have you here. Tell us a little bit about your backstory, your background, and what got you to CMMB.
Sure. I grew up in a big Catholic family in the Midwest, and having grown up in Michigan, was interested in the rest of the world, but felt very locked in there. So I went to Georgetown University and studied international politics, and that led me for a first post right out of college as an intern in Pakistan in the 80s when there were Afghan refugees coming across the border with Catholic Relief Services. And that led to a deep interest in public health, which I really didn't know much about. So I'm not trained as a clinician. I came back from the time overseas and did a short stint actually studying economics at the University of the West Indies as a Rotary Fellow. But then I went on to public health school at the University of Michigan, very close to where I grew up, and really found a great love for international health through my studies there, both because there were so many international students in our program. So I was learning from people who were living the reality that I was seeking to address, but also because Michigan had a really strong program in international health. So after that, I spent much of my career, about 20 years of my career, with Save the Children, working on building maternal and child health programs with frontline doctors, nurses, and other health workers in about 25 countries around the world. So doing a lot of training, but also designing programs and working with them on trying to make a difference in the basics of maternal and child health care. I was also very involved in the creation of a program called Saving Newborn Lives, which were funded by the Bill and Melinda Gates Foundation, but which were really looking for what are those key interventions that can help reduce child mortality or newborn mortality in low resource settings. So after many years with Save the Children, I was kind of looking for a new opportunity. I spent a little time leading an organization that was focused on childhood resilience, children living with cancers and other life-limiting illnesses. It's called Serious Fun Children's Network, and it was started by American actor Paul Newman with the Hole in the Wall Gang Camp, but now it's a network of camps around the world, including supporting children in Africa and Asia who are living with HIV. So it seems like a very, continued global perspective on how are we making life better for women and children. And I got the opportunity to interview for the job at CMMB, which for me was fantastic. It was just a point in my life when I was looking for a leadership position and going back to maternal and child health, sort of my true love, and then blending that with my own faith tradition was also wonderful for me. So that's what brought me to CMMB to work on these issues.
Sounds like you've been on the road much of your career.
Yeah, I have spent, I think I'm up to about 57 countries visited through my work, and it's been really fabulous. And it really helps you understand the universality of really wanting to raise healthy children. I mean, I'm a mother and I've met mothers all around the world, and we all share in those hopes and dreams for the health and education of our kids. And that's what I really kind of focus my career on, is trying to make sure that that's assured for people in other countries and in different settings.
So let's talk about CMMB and the reach of the organization. Delivering medicines to 39 countries at last count, just in the last year. Is that accurate?
Right. Within the last year, right? So every year when we, first of all, the whole medical donations program has long been part of our history, but we work deeply in 5 countries, but we have partners who work in many more countries. So as we take medical donations in, we're seeking partners who are interested in delivering those and looking at the needs on the ground, responding to felt needs in different countries around the world and in their programs. And so we're able to reach many more countries than the 5 countries where we have a country office.
So when you add up that whole network together, I mean, how many facilities are we talking about? It's mostly facilities-based interventions, I assume.
Yes. So some of our partners would have whole networks of clinics and facilities around the world that they're supplying with these necessary drugs. So I think last year we did about 130 shipments. We have 37 different partners who are distributing those from many, many different donor companies. So it's really been a great way to penetrate and get, needed, affordable, quality medications to the periphery, which is, the hardest place to find medicines often.
Yeah. Well, and that's where the connectivity with our members comes in. Many of the companies that you're working with are AAM members, and we're pleased to play our small role in bringing you together with those companies that are donating much needed medicines.
Yep, 10 of our partners on the donation and partnership side are AAM members. And for us, it's been a great pleasure to be part of AAM. We also, have been part of setting standards through the work of PQMD. So we've been a founding member of the PQMD group as well. So we've been in this dialogue and in this partnership to supply clinical facilities around the world with needed medicines for over 60 years.
So tell us a little bit about some of your ongoing initiatives, either in your 5 primary countries, and what are those 5 primary countries, and what are some of your ongoing projects and initiatives?
So in the countries we work in, and I was just traveling, actually, just came back this month from a trip to Africa where I visited our programs in South Sudan, Kenya, and Zambia. And we also work in Peru and Haiti. So in those countries in particular, we go quite deep with partners on the ground to try and strengthen community healthcare systems through a program we call CHAMPS. So that's a children and mothers partnership program. So working with our local partners, often also with either a government hospital or a mission hospital, who are referral hospitals for pregnancy and maternity care, those kinds of things, but also really looking at how much care can be provided to community members through community health workers. So there are a lot of interventions for child health that can be provided, screening that can be done, treatments that can be provided right at that household level. So we've trained thousands of community health workers who go out, often on bicycles. We have a partnership with World Bicycle Relief, putting them on bicycles so they can cover their territory a bit better. But then they are able to assess children's needs. They have a regular set of training materials that they use with moms. So on a one-to-one basis, as well as community gatherings, they're trying to impart key messages about health and then assess children and provide treatment where needed. So that's why certain essential medicines are really critical to our work. But within those kinds of screening areas as well, we often can find children and other people in the community who need different levels of care and refer them to those health facilities that we're also working on strengthening. So that's the biggest part of our work in the 5 countries that we work in. We're also a significant player and have been for many years for almost 25 years in the arena of HIV prevention and treatment. So we were one of the early players in partnership with the US government on the PEPFAR initiative and other initiatives to try and find out how, especially how faith-based organizations and faith-based leaders can help destigmatize seeking voluntary counseling and testing for HIV, as well as keeping people on treatment for HIV, which is a big part of our program, especially with youth that I got the opportunity to see in our work in Zambia.
COVID obviously impacted the whole world. So I'm just curious how, if you had to change the mission momentarily or still have had to change the mission to meet the demands of the global pandemic and how that impacted your work.
So in terms of our response to the COVID epidemic, I joined the organization during the middle of the pandemic, and CMMB was already involved in procuring and providing PPE for health workers around the world, for some of the hospitals that we work with. There were great shortages of protective devices. We did a lot of work on water and sanitation, putting in water, not always water systems, but just even simple things like water tanks in hospitals and facilities where there is not water. I think people would be shocked to know that 1 out of 4 health facilities around the world does not have access to water and sanitation in the health facility, which is just mind-boggling to me. It's a problem that's been estimated to cost about $3 billion to fix, $3 to $10 billion to fix, and it just should be done. How can we have health facilities without water and sanitation? So those were some of the first things that we did, was try and help on the prevention side.
So in addition to handling all of the sanitary issues around COVID and isolation that was necessary, when the vaccines became available and were starting to ship around the world, did the CMMB play a role in vaccine distribution?
In fact, in 2 countries, we were, and we continue to be, a major provider of vaccines, both in Haiti and in South Sudan. So 2 countries that have among the lowest coverage in the world, actually, with the COVID vaccine. We've been very involved in, first of all, mobilizing community members to come to vaccination, but also training vaccinators and handling vaccination outposts. So in both countries, the original idea was try and get people to come to facilities for the vaccination, but we found we had to get a little bit closer to the community and do outreach sessions. When I was in South Sudan, I had the opportunity actually to be part of a sort of Saturday morning market vaccination pop-up. So we had bright umbrellas and it was about 102 degrees. So those umbrellas were enough to attract some people just for a bit of shade, but people came, asked their questions, and we had a team of people to provide counseling, to register people for vaccination. And then we had a team of vaccinators as well. So it was we really realized that part of the importance of faith-based leaders can be in educating populations who are feeling concerned or nervous about receiving a vaccine. And then part of our work was just actually then setting up with clinical facilities as well as other trained health workers and outposts to do the vaccination. So we're really proud of being part of the solution in those cases, but there remain many more people to vaccinate in most of the countries where we work.
So a few years ago, AAM went through a branding change, but this is something that you've recently gone through as well. And an organization like yours, 110 years old, to change that brand, what was the rationale behind that, and how is that working for you, and how do you keep the story and the history together with the new brand?
So the old brand had some sort of medical symbolic symbols in it, and it also had some religious symbols in it. But in fact, I think in 2015, the thinking was that we need to both refresh the brand as well as really highlight the very specific kind of work that we're doing. So our new brand it actually is circular in nature, which refers basically to the global nature of our work, but also it has in the middle of it what is kind of an ampersand. I mean, we cannot work alone. We only work because of our partnerships, and that includes partnerships with AAM members as well as the district health folks that we work with around the world, government authorities who also are interested in drug supply and how they can improve the access to affordable quality medicines. We couldn't do our work without those partners. So the firm that we worked with came up with that ampersand, which kind of doubles to both connote the idea that partnership is very important to our work, as well as the fact that it also can look like a mother and a baby. And that dyad is really at the center of our work. So it's been, I think for us, it softened our image a little bit. It just, kind of became more inviting, but also it helped people really understand what's central to the way that we work, which is the health of mothers and children and working with partners.
So looking forward now, what are some of the new goals or kind of strategic objectives for the next few years for CMMB?
Well, we want to continue to respond both, we do, especially in our medical donations program, we're able to respond in emergency settings. So right now, for example, we are responding to the needs of Ukrainian refugees, as well as people inside Ukraine, by sending medical donations into those sites. We continue to supply other countries where there are important health needs that are met with the kinds of medications that are available to us through these partnerships. And our work in the 5 countries is really focused on how can we distribute authority a little bit differently through creating local institutions, which we believe will be more sustainable in the long run. And so the goal is really to work with those organizations on the ground. For example, in CMMB Zambia has already registered locally as a local NGO, and we're trying to provide support to them as they build out their board and take on some other important roles as they move toward a more independent but inside the family status. So the strategic plan that we're working on now is about building the capacity of those 5 country offices and strengthening the impact of our medical donations program so that we really can help our partners understand their impact, which many of our partners are quite interested in knowing more about.
You mentioned the core mission around women and children, but then the need to be able to quickly kind of put out the call that there are needed medicines in this certain country for this certain condition that has come up, or vaccines. So I think being nimble is also a really important part of the work that you do, correct?
Yes, and it's I think people think of a older organization as not being nimble, right? We're 110 years old. We just don't work like we used to. That's for sure. And we've got a team that's just incredibly responsive and really focused on what we call subsidiarity, which is this idea of moving decision making closer to the people affected by decisions. And that really calls on us to kind of be good listeners. So really trying to ascertain what are the needs in the field from their own perspective. That goes for the medical donations program, and it goes for our maternal child health programs and community health system strengthening programs. So really trying not to be so directive and be much more responsive to needs that we hear from our partners on the ground. So
Mary Beth, thank you so much for being on the program today. We're really glad you're part of the team at AAM. We're very proud of our members and been able to connect them together to provide these much needed services around the world. So thank you for your dedicated efforts, your team's efforts in the underserved communities that you serve. As you say at your organization, Healthier Lives Worldwide. So congratulations. Thank you for everything that you're doing. And on behalf of the entire AAM board of directors and our team, I would like to wish you all the best and for success in the future going forward. And thanks again for being here today.
Thank you so much. The partnership is so valuable to us. So I'm really grateful to you and the members of the AAM.
Thanks for tuning in. That's this month's episode of All Access, and we'll see you next time.